What's up, beautiful people? Another day, another study. We've recently seen evidence showing that the way that we interact with our smartphones and interact with social media is having adverse effects on our mental health and well being. The average American spends about 4.5 hours on their smartphone a day. We spend about 2.5 hours on social media a day. We've seen that smartphone notifications can impair our attention and focus on tasks. Even having your phone visible can decrease working memory and attention, which is why usually for me, my phone is not visible. It's either upstairs with the ringer turned all the way up or behind me. It's just not somewhere where I can reach it. And, we've all grabbed it out of just habit and turned it on. Like, why did I even do this? I wasn't even looking for it. There's no notification. I just did it out of habit, right? So, more and more studies have come out recently showing that taking breaks from social media can be beneficial for various aspects of mental health. This study was a randomized controlled trial, crossover trial, where they basically had people install an app on their phones that blocked internet use. And they found that the app did reduce screen time, so people used their phones less when they didn't have access to the internet. The intervention saw improvements in well being and mental health and sustained attention. In fact, the effect size they saw for depression was larger than the effect size seen in a meta analysis of antidepressants and similar to one that was seen for cognitive behavioral therapy. Now, you can't directly compare the two. This wasn't a network meta analysis. This wasn't a randomized trial of blocking internet use versus antidepressants. It's just an interesting finding utilizing that effect size. Nearly 91% of the participants showed an improvement in one of the three outcomes that they measured. And when they looked at the mechanism of how this could be beneficial for these three outcomes, they found that people increased their time in the offline world, so not connected to social media or the internet. They decreased time spent consuming media. People had increased feelings of social connectedness, so they felt closer to people. They felt like they had more self-control, and it improved sleep. And patients who had higher baseline levels of FOMO experienced more benefits in well-being and mental health with the intervention. So I think it's pretty clear that we're seeing that the way that most people are interacting with social media could adversely affect mental health, well-being, attention, and that being more mindful of how you're using social media, maybe reducing your social media or smartphone use, may have benefits for mental health. And in fact, I'm actually talking about this in my book. I've done a talk about this. I'll be talking about how I've interacted with social media, the pros, the cons, and how we can leverage social media to get the benefits while reducing the risks that we are seeing in the literature.